Do you like your doctor that you have been going all your life or for a long time that you really trust? And do you like your local hospital? Well, if you do and you want to keep them, this is one video that you don't want to miss. My name is George Ibanez. I'm a licensed insurance agent, and my company specializes on helping people that are on Medicare in helping you select the right plan for you so you can make the right selection from the very beginning. Today, we will be discussing the exodus of doctors and hospitals leaving Medicare Advantage plans and the reason why they're leaving those Advantage plans. So keep watching because you're going to learn a lot today. Doctors and hospitals are furious with Medicare Advantage plans. And the reasons why they're furious are because of the delay in reimbursements, pre-authorizations, and a necessary delay for treatments for your Medicare Advantage providers. So I can see every day how there's more and more quality doctors in quality hospitals that are exiting the Medicare Advantage networks and they will not see you if you have a Medicare Advantage plan. So at this point, the only thing that I can recommend and the only thing that I can say, if you want to keep your doctor that you like and you want to keep your hospital that you like, is that you get a Medicare supplement plan. That's the only way that you're guaranteed that you're going to keep your doctor and your hospital. Because when you have a Medicare supplement plan, different than on a Medicare Advantage plan, on a Medicare supplement, there are no networks. So if you have a Medicare supplement plan, if your doctor accepts original Medicare, which about 96% of all the doctor in the USA accept, and probably close to 100% of the hospitals, you can go to any hospital you want, any doctor you want. You don't have to worry about networks. You don't have to worry about pre-authorizations, and you definitely don't have to worry about delays to get your treatment that you very much need. Let's use some common sense now, and let me make sure that you understand the difference between Medicare supplement plans and Medicare Advantage plans. On a Medicare supplement plan, there are no networks. It mirrors and it will pay what Medicare pays, and what they will do is Medicare will pay 80% of the bill, and the Medicare Advantage will pay the balance, the 20%. That's it. That's simple. So if you have a Medicare Plan G, for example, and you have an annual deductible of $240, it doesn't matter how big the bill is. If it's a Medicare approved expense, after you pay that deductible, Medicare will pay their 80%, and the Medicare supplement will pay the 20%, and that's it. You won't have to pay any more than that. There will be no networks, there will be no restrictions or anything. That is a Medicare supplement. Now, in contrast, you have a Medicare Advantage plan. Medicare Advantage plans are completely different in supplements. For starters, when you have a Medicare Advantage plan, you're giving up your original Medicare. Medicare is basically giving the responsibility of your health care to a private insurance company. So at that point, those networks and those plans work very different as traditional health insurance plans or group insurance plans. And the way that works is you will have networks of doctors and hospitals. You will have to go to that network that is assigned by the insurance company that you sign up with. And within that network, if you go to if you have a PPO, you can go to in or out of network doctors. But if you go to a doctor that is a network, it's fine. You're going to pay a smaller copay. If you want to go to a doctor that is out of network because your doctor left the network and now you need to go to him, you're going to pay a much higher copay, even if you have a PPO. If you have an HMO, Medicare Advantage plan, you won't even be able to go if the doctor is out of network, because it will only allow you to see doctors that are in the network. That's number one. Number two, the huge difference with the Medicare supplement plans is that on a Medicare Advantage plan, you will have copays, lots of copays. And the only areas that you're not going to have copays is perhaps for a routine doctor office or from some testing and evaluation, just to make sure that you're fine, that you're good with things. But if you have an issue and it requires for you to get a test done, like an MRI or a CAT scan or anything like that, you're going to pay some big copays. If you need a hospitalization, you're going to pay big copays. If, God forbid, if you need treatment for cancer, you're going to pay 20% of the treatment with a cancer with a Medicare Advantage plan. And that can be a very, very expensive proposition at 20% if that's the part that you have to pay. So there are some significant differences. Also, with a Medicare Advantage, you will have to get pre-authorizations for surgeries, MRIs, CAT scans, et cetera, which you will never need with a Medicare supplement plan. So it's really important that you understand that Medicare supplements and Medicare Advantage plans have nothing in common other than just the Medicare name ahead of the word supplement or ahead of the word Advantage plan. They're completely different. With Medicare, you have Medicare administering basically, and you have an insurance company just paying their 20%. Medicare pays their 80%. The insurance company pays the 20%, and you're done. You don't pay for anything else other than your deductible. If you have a Plan N, you will have to pay a small copay of $20 for the doctor and $50 for the emergency room, but that's it. So very important that you understand the difference between these very, very different plans. The other thing that is important to understand is, as far as the difference between supplement and Advantage plans, Medicare supplement plans are permanent plans, which means that your Medicare supplement plan that you have right now will be the same next year and the year after and the year after that, and it will not change. It will not be modified. It will not change. The only thing that may be a little difference if they increase the deductible a few bucks here and there, year to year, but as far as the way the plan works, that never changes. Unlike the Medicare Advantage plans, which are yearly plans. So you have a Medicare Advantage plan today, this year, and next year it could be completely different. It could be 100% change. It could even be canceled and replaced by a different Medicare Advantage plan. Same thing with the networks. You may have a doctor that, yes, you check the network with your insurance agent, and that doctor is in the Medicare Advantage plan network. But if the doctor decided to change, they changed their mind, they don't like the insurance company because they're not paying them right, or they're delaying on their pre-approvals or anything else, the doctor can exit that network. And if you sign up for a Medicare Advantage plan in January, during the open enrollment period, which is October 15th through December 7th, and then the doctor decides to start your plan January 1st, and the doctor decides that they're not happy with the insurance company for whatever reason. And it happens all the time, by the way. And the doctor decides to exit that network of that insurance company after March 31st, it's the last time that you have to change the plan for that particular year. Then you got a problem, Because if the doctor leaves after March 31st, which was the last time to make a change, you will be stuck with that plan that you have, whether your doctor is there or your doctor is not there. And if you're fond of that doctor and you absolutely have to that doctor, you're not gonna be able to go. You're gonna have to find another doctor. The same thing with the hospital. If the hospital changes and they say we're not taking advantage plans anymore because we're not happy for whatever reason, then you're not gonna be able to go to that hospital, and you're gonna have to wait till the following year to change to another Medicare Advantage plan that accepts your doctor and your hospital, and hopefully you will not have the same problem again. So at this point, the only way that I can tell you that you will be able to keep your doctor and your hospital for sure would be if you sign up for a Medicare Supplement Plan, because those plans never change. I have a perfect example that I can give you about a potential client that called us yesterday, somebody that I talked to about a year and a half ago, and I had offered a Medicare Supplement Plan. She called us for a quote. We gave her the Medicare Supplement Plan quote, and we never heard from her again. So she called me yesterday, and the last time we talked was roughly about a year and a half ago. And yesterday she tells me that, hey, I remember you and I had a conversation about a year ago at a Medicare Supplement Plan, but I decided to go with a Medicare Advantage plan. And now my doctor has left, her cardiologist, which is her main doctor, left the Medicare Advantage plan network. And this lady asked me if I could put her on a Medicare Supplement Plan. And there's two issues with that. Number one, this is not the time of the year that she can change her Medicare Advantage plan into a supplement. That's one of the challenges. But the biggest challenge is that in the last year and a half, she had developed a condition, a heart condition, in conjunction with her diabetes, which will preclude her from being able to be on a Medicare Supplement Plan, because she will not get approved based on her current condition. So now this lady will not be able to change to a Medicare Supplement Plan. She's stuck with a Medicare Advantage plan, and she will not be able to change to a different Medicare Advantage plan in order to keep her doctor till next year. Yes, she can make the change October 15th through December 7th, and select a different Advantage plan with a different network, but she won't be able to use that till January 1 of 2025. And hopefully, I'm hoping that whatever doctor or hospital she selects, that doesn't do that again the following year if she needs to use the doctor, and all of a sudden the doctor decides that they don't want to be in the Medicare Advantage Plan network for that particular company for whatever reason they have. They don't even have to have a reason. They just simply can say, I don't want to have this contract anymore because I don't want it, because they're not paying on time, or there are delays on coverage or anything else. And I'm not going to mention the insurance company that was the network that this particular doctor decided that he didn't want to be with them anymore, but I can tell you that it was a major insurance company with a major network, and somehow they got this doctor very upset, and he decided that it wasn't worth his time to waste his time doing paperwork, resubmitting pre-authorizations, and everything else that he had to do. So he just simply exited the network, and most likely he exited all Medicare Advantage plans networks and decided just to take Medicare, or Medicare in conjunction with a supplement. I couldn't tell you the reason because I don't know, obviously. But the bottom line is, this person will not be able to continue using her provider that she has been using for years. I can tell you that a lot of people that sell those Medicare Advantage plans, like the ones you see on TV with all the personalities doing the commercials, they're call center employees. And the only incentive that they have is financial. Their incentive is strictly for you to buy. If you buy and you buy a Medicare Advantage plan, they're going to make a big commission. They don't care if you're happy or if you're not happy with it, because they will never talk to you again as far as giving you any kind of service. When you talk to a call center agent, that agent will talk to you only once when you sold it, when he sells you the deal. And after that, you'll never be able to talk to that agent again because he's just a sales guy. That's all he does. He's not the person that is going to be servicing your account just like we do. We're an insurance agency. We're a brokerage house. So when we place you on a plan, whether it's a Medicare Supplement or a Medicare Advantage plan, then we have to service the plan. Then we have to make sure that you're satisfied and you're happy and your medication is updated and everything is up to date. We have to look at your pricing, making sure your pricing is good. If not, we got to suggest a change, whatever it is. But it's not the same with a call center. So buyer beware. If you're buying insurance from one of those commercials on TV, or you're buying insurance directly from a call center of an insurance company that all they can do is sell products from that particular insurance company, be careful. Because number one, if all they have is one insurance company to suggest or to select or to choose from, what do you think they're going to give you? They're only going to give you that company. So if somebody's working for Humana, they're only going to sell you Humana. If somebody's working with United Healthcare, they're only going to sell you United Healthcare, and so on and so forth. If you go to a broker, that broker is completely different because that broker represents multiple insurance companies. And that broker doesn't really care which company you select in terms of whether you go with United Healthcare, Humana, Blue Cross Blue Shield, whoever it is, it's all the same. It all pays the same to the broker. So that is not the motivation of the broker. The motivation of the broker is that he places you on the right plan that is the best plan for you, and that you stay on the plan for a long time and that you're happy with the plan. Because unlike a call center agent, the broker that works with you, putting you on the plan, then has to service your account. They have to take care of you when you have a problem. They have to take your calls. So you're going to find out that brokers are going to be much more straightforward than anyone else because they are the people that take care of you when you have a problem, and they don't want you to have any problems, so they don't have to constantly service the account for no reason. So they will put you on the right plan from the very beginning. I will be very honest with you. This behavior from call centers and for advertisers that use TV personalities to lie and mislead seniors about Medicare Advantage plans and make them believe this and that, it truly disgusts me. The fact that you have a TV personality misleading seniors on TV and steer them towards going to a call center to buy a product that they already know that is not as specified on TV, it's horrible behavior. And I don't understand why somebody that is a millionaire, like most of those TV personalities, will stoop so down to try to simply make a buck by making a commercial that is extremely misleading. And you're going to see a lot of those commercials will probably go away this year, and they have been going away little by little because Medicare has really clamped on them. And they're really, really looking at them very closely. In essence, if you want to keep your doctor and if you want to keep your hospital that you like to go, the only way to make sure that you will keep your doctor and your hospital is to go into a Medicare Supplement Plan and not into a Medicare Advantage plan that your doctor may come in and out of the network at their leisure. So Medicare Supplement Plan equals stability. Medicare Advantage Plan equals changes every year in possibly losing your doctors that you like and your hospital that you like. At the end of the day, if your agent or broker is only talking to you about a Medicare Advantage plan and they're not talking to you about a Medicare Supplement Plan as an option, my best advice to you is to hang up the phone, run away from that broker, and give me a call, because you have to know all your options, and you have to know your options in advance when you're on Medicare, because the decisions that you make today will affect you tomorrow, and tomorrow may be too late. So it's important that you make the right decisions from the very beginning. Now, when you talk to one of our agents, what they're going to do is, if you're looking for a quote for a Medicare supplement plan, they're not going to look at just one Medicare supplement plan. They're going to look at all of them. They're going to look at Mutual of Omaha. They're going to look at Aetna, Humana, Blue Cross Blue Shield, every carrier that is out there, United Healthcare. And then they're going to select whichever one is the one that works best for you and your budget. And yes, you may have 20 different Medicare Supplement Plan Gs or 20 different Medicare Supplements Plan N to select from. So understand, and this is very important that you understand, all Medicare supplement plans of the same letter are the same. They're identical. They're formed by Medicare, and Medicare is the one that decides how they're made. They're all made the same. So a Plan G from one company is the same as a Plan G from any other company. Same way as a Plan N. One Plan N is the same as any Plan N from any company. So what we do is we look for whatever plan works best for you, G or N, whatever one works best for your budget. And then we narrow it down. Once you decide whether you want a Plan G or you want a Plan N, then we'll take a look at 10, 20, 15 companies, whatever amount of companies we have there. We'll look at the rates. We will look at the rate continuity. We will look at making sure that that company does not have chronic rate increases, et cetera, and then we will decide whichever is the best plan option for you, the plan that will work best for you and the plan that will work best for your budget. Finally, if you like the contents of the video, give me a like and subscribe so we can continue making informational videos for you, and we will continue helping you making the right decisions when going into a Medicare plan.